Hi, I'm Dr. Jeffrey Moses. I'm John and Myrna Daniels Professor of Cardiology at Columbia University, and also the head of advanced cardiac interventions at St. Francis Hospital and Heart Center in Roslyn, Long Island. This is a specific problem in the United States, in that um, right now, before the release of the drug-coated balloon, in this case, the AGENT balloon, all we had for in-stent restenosis was the choice between balloon angioplasty, another stent, or brachytherapy. And for well over a decade, the technology of drug-coated balloons has been available pretty much worldwide, and that's been a huge hole in the therapeutic armamentarium of American physicians. Well, the patient population were patients with in-stent restenosis, with high-grade lesions if they weren't symptoms, but 50% or more if they had symptoms, without total occlusions. Um, Usual exemptions for STEMIs and thrombus and vein grafts. Um, there were some limitations in terms of the length of the lesion and the sizes due to the balloon matrix. So the vessels were from 2 to 4 millimeters in diameter, and the maximum length visually was 26 millimeters, because we were limited in this study to a 30-millimeter balloon, and we needed to be able to have a 2-millimeter margin of drug coverage on either side of the lesion. Well, the key findings were a major reduction in target lesion failure, which was cardiac death, MI, and target lesion revascularization, from at 1 year, 29% to 18%. The extension here is to 2 years out, and this is the time to first event assessment. The TLF was reduced from 34 to 27%, which was still statistically significant. I think the other important finding, though, which is looking at all events, it's, in other words, even recurrent TLRs, because that is really the real problem with these type of lesions, is their consistent recurrence. And the best assessment is the average number of events, all events, that any average patient had was about 0.44 for the balloon angioplasty, and at around 0.2 per patient for the agent balloon, which is overall almost a 50% reduction in all target lesion events. Well, if anything, the unexpected was favorable. In other words, we did find a reduction in MI, and that makes sense because a fair proportion of in-stent restenosis does present as MIs, especially non-STEMIs, and also a reduction in stent thrombosis. And this was particularly in the multi-layer patients, which exclusively had the incidence of stent thrombosis. We saw this at 1 year. We did not see any additional stent thrombosis from 12 months to 24 months, however. Well, they give a whole array of options to the U.S. physicians that they didn't have before, because the problem has been, how do we get another drug into the vessel, especially when you have multi-layer stents? And there's a real hesitancy in multi-layer stents to put a third stent, justifiably, and also in smaller vessels to put a second layer stent. There are other complicating issues, such as bifurcation, where a second layer of stent especially could really double cover a major branch. So this gives tremendous options to increase the safety of our treatment of in-stent restenosis. There are many questions to be answered. A particularly important one, I think, is the optimal treatment of the first in-stent restenosis, especially in larger vessels. Some physicians really favor leaving nothing behind even after one stent. And others might say, well, DES are tried and true for in-stent restenosis. For the larger, more focal lesions, maybe that should be the first choice. And I think randomized trials should be really considered in that regard. And also, of course, there's a whole world of bifurcation techniques. Instead of a second stent in this daughter vessel, maybe using DCBs, which is very popular overseas. And also, of course, and these are ongoing studies now, small vessels and diffuse disease, where leaving no metal behind and leaving other options, for instance, subsequent bypass surgery on the table for these patients would be strongly considered if these balloons are efficacious in that population.